Third, how may the coping behavior of the nursing student be described as to avoidance, problem solving, stay optimistic, and transparency? Fourth, what is the relationship of the socio-demographic characteristic of the respondent to their coping strategies in dealing with stress in clinical setting? Is yung coping strategies natin yung mag-overcome sa socio-demographic natin para maiwasan yung stress. Conceptual framework. Nursing student experience higher level of stress than student in other health science. The clinical conceptual framework. Nursing student experience higher level of stress than student in other health science. The clinical part of nursing education is more stressful than the theoretical part. A study in Bahrain found that all nursing students experience moderate to severe stress in the clinical setting. Also, a conducted study in Iran revealed that 99.3% of nursing students reported the level of perceived stress as moderate to high. The common cause of clinical stress in nursing students include the fear of unknown events, working with equipment, staff and faculty instability, theory and practice gap, the fear of making a mistake, and communication with staff, peer and patient. Stress can lead to disease, change in health, poor academic performance, student withdrawal from the program, and ultimately affect the quality of patient care. Because nursing students are not able to avoid this stressor, it is necessary for students to cope with them. If they are not able to manage their stress, it will affect their performance, health, attitude, and role satisfaction as a nurse. In a stress adaptive strategy, the individual's ability to coping with stress is more important than the stress itself. Suitable coping method reduce stress injuries. Coping is a dynamic behavioral and cognitive effort in controlling internal and external stress. There are at least two types of coping strategies: problem focus and emotional focus. Each individual uses one of the strategies depending on the type of threat, previous belief, or impermanent factor, such as changing strategies based on type of feedback. Research has demonstrated that nursing students employ a variety of coping strategies such as talking to friends, sport, crying, ignoring stress, feeling of sadness, and the use of alcohol, which may be adaptive or maladaptive. Some students have pointed to problem solving as a most utilized strategy in nursing students. Others refer to emotional focus coping method, while some believe that transparency, optimism, and problem solving are most used strategies among nursing students. Since coping strategies of nursing students affect their physical and mental health as well as quality of care provided by them, identifying coping strategies of nursing students is important for early intervention. Coping must be examined in the context of dealing with a particular stress. Gleason and Gerg recommend that qualitative studies be used to deeper and better understanding of coping strategies. Even though coping is a context-dependent phenomenon, studies on coping with stress by nursing students in clinical settings in Iran have been mostly quantitative, which use general questionnaires from other cultures. This methodology does not lead to a deep understanding of nursing student coping strategies.
So next is methodology. This chapter of the study presents the research design, sampling, instrumentation, data gathering procedure, and method of data analysis. 3.1 Research design. In this study, the quantitative type to analyze and to interpret the conducted information for us to come up into our conclusions. The researcher used cross-sectional research design. Cross-sectional research design aimed to find out the prevalence of phenomenons, situation, problem, attitude, or issue by taking a cross-section of the population. The cross-sectional study is simple in design. The researcher decides what he wants to find out, identify the study population, select a sample if needed, and contact the respondents to find out the required information to ensure that the relevant data is collected and analyzed accurately. In accordance with the research question, the descriptive survey design was employed. The design has the potential to provide a lot of information regarding the coping strategies from a large sample of nursing students within a short of period. We use quantitative research design because in this study, we tackle the experience of second-year nursing student and we need to show through numerical explanation the percentage of the response of our respondents. 3.2 respondents of the study, 153 second-year nursing students from selected private schools in Cabanatuan City were selected by random sampling method to be research participants. They are asked by the researcher to answer the provided questionnaires within specific time duration. The researcher focused on the second-year nursing students because they are one who are now newly exposed into clinical setting. The following table shows the total number of second-year nursing students who are now exposed into clinical setting. Out of many colleges in Cabanatuan City, we select 5 private schools in Cabanatuan City. First is Pinma Arroyo University, have 40 second-year nursing students. Next is Wesleyan University, Philippines, have 165 second-year nursing students. Then Good Samaritan College, have 21 second-year nursing students. Our Lady of Fatima University have 60 nursing students. And last, Dr. Gloria D. Lacson Foundation College have 16 second-year nursing students. In total of 302 nursing students, but we only get 51% in every school.
3.3 sampling. The researchers used random sampling method. 153 selected second-year nursing students in selected private school in Cabanatuan City. Out of 302 second-year students were used as the respondent of the study. The researcher get the 51% of each total number of second-year nursing students to come up into our exact number of respondents. So name of school, Pinma Arroyo University, number of second-year nursing student, 20. Wesleyan University, Philippines, 84. Good Samaritan Colleges, 10. Our Lady of Fatima University, 31. Dr. Gloria D. Lacson Foundation Colleges, 8. So our subtotal is 153. So out of 302 second-year students were used as the respondent of the study. The researcher, our research, get the 51% of each total number of second-year nursing students. So we will come up to our exact number of respondents. So that's our 3.3 sampling. 3.4 data gathering procedure. The study went through a number of steps before and during data collection. To solidify the plausibility of the study, the researchers conducted a pre-survey visit in the selected private school in Cabanatuan City to gather data on the embodiment of each school core values. The researchers met the school dean or the faculties to inquire about their core values. The researcher then administered the questionnaires upon the scheduled conduct agreed by the school faculties and the researchers.
Instrumentation. The researcher used questionnaires in gathering needed information from the respondents. The respondents of the study read and interpreted the expected questions and answers. In this study, the research questionnaires was composed of 3 parts. The first part was intended in gathering information about the socio-demographic characteristic of the respondents, such as gender, age, family income, allowance, religion, etc. The second part of the questionnaire was the list of questionnaires intended for determining the different stressors perceived by the nursing students. These are the list of questions that identifies the sources of their stress from the teacher, colleagues, peers, any other stress that they are experiencing inside or outside the hospital. The third part was adapted list of questionnaires from the internet. Coping behavior inventory questionnaires created by the SHU 2002. The coping behavior inventory questionnaires is widely used to determine the coping strategies. To ensure the relevant data is collected and analyzed accurately, in accordance with the research questions, the descriptive survey design was employed. The design has potential to provide a lot of information regarding the coping strategies from quite a large sample of nursing students in short period of time. Especially quantitative data. Quantitative data was obtained through the administration of questionnaires to undergraduate nursing students and clinical placement in the School of Nursing and Midwifery. In sampling, the population of nursing students on clinical placement was divided in 4 homogeneous cohorts, using the academic and level as the basis for the stratification.